Day, and welcome to our partnership with the Guam Nurses Association. This is our network of nurses, and we have today Paula Manzon of the Guam Memorial Hospital. Day, Paula.
Day, Chris.
In talking before this interview, you have a really interesting job, and if you could just share with us, just give us your title and again, layman's terms, right? Because we're not doctors. Just describe the work you do at the hospital, and then we'll kind of get into what we discussed specifically about COVID.
So I'm the clinical nurse informatics supervisor here at Guam Memorial Hospital. That particular position is fairly new here on the island. I'm also a registered nurse, and I'm certified in nursing informatics. So that's my title here. It's basically a nurse that's connected with the IT department, but also has a background on nursing per se. So I bring those two worlds together, and then we play a critical role in patient care by providing all of the technologies needed for all of our clinicians on the floor. That's basically what nursing informatics is.
Right, and so when we talked about this, you're responsible for the electronic health records, and you make sure that the right information from the right patients goes into this so that the doctors can make the right call when providing acute, critical, and traditional care at the hospital, right?
That's absolutely right. And it's just not me, but there's a whole team from IT and then the clinical side as well. And the ancillary side, all of our respiratory therapists, all of these people contribute to this one project that we have currently for the electronic health record.
Right, and so that's where your nursing background comes in, because you're just not inputting data, right? You have to have that understanding of what the data and that information means to patients and doctors.
Yes, definitely. So I've worked on the floor for about 4 years. I'm a graduate of the University of Guam. So basically, if we needed an equipment or a technology equipment on the floor, you need to understand how to use it. And as a nurse, I would say, oh, that doesn't work that way. This is how the nurse would use that particular machine per se, yeah.
And so we talked about what your duties have kind of shifted to recently with the onset of the coronavirus pandemic. And I thought it was really interesting because in a lot of ways, well, I guess not even in a lot of ways, but you are connecting patients who are fighting COVID-19 who aren't able to see their family members because of how contagious and insidious this virus is. You're connecting them with those family members through the use of technology.
Yep, so in the first wave, we were actually seeking out to purchase tablets, and you know what, there's so many people in this community are so giving. Businesses on all sides, IT&E, GTA, am I forgetting something? Docomo have all given us tablets to use. And then on the second wave, even more so now, we have more patients in the hospital. So we placed iPads inside of each and every room. And then we connected one to the iPad in the nurse's station. So whenever we needed to call the patient or the patient needed to call the nurse's station, they can have video conferencing, and that reduces exposure for our staff needing to go in there for just one thing or multiple things.
Right.
And also we plan to do things like stream masses, because it's really, you know, when I was setting up those iPads in those rooms, it's really, really isolating, and it's very sad. But we wanted to make sure we can do that for each of the patients, and it's really helped out. Even with clinician to clinician, we're using Zoom now via tablet, so we can communicate better as a team. Our management is using Zoom and those capabilities as well.
Was this an idea that was prompted by maybe something you guys might have seen nationwide?
Yes, of course. As an informatics nurse, we always have to research and be on the cutting edge of things. We want to look into that, especially here on Guam. We feel so very isolated from everybody else, but the research on that particular thing is that these technologies can help. Though we don't want to take away the human interaction completely, because that's how nurses are. We care for our patients and we want to be right near them. But in this very case, we looked at other hospitals and what they're doing in regards to technology. So that's what we came up with. Not only that, telemedicine is a big thing. It's one of our big projects here. Right. Having to do telemed from here to Guam Behavioral Health, so we don't have to transfer our patients there. It's such an efficient way to be able to give our patients access to different things.
And when you talk about being able to stream masses and allowing these COVID-19 cases to maybe talk with their families through Zoom, a platform like this, is that what's happening with these devices at GMH?
Yeah, so we have several platforms that we use, not only for telemedicine and for patient care. So we have Zoom Healthcare. That's what we use to communicate with them. Pretty secure. We have security controls on all of the devices that we have. Yeah.
Let's talk about the isolation that comes with COVID-19, right? So again, highly contagious. It finds a way to transmit itself from person to person. We've seen that, at the hospital. I mean, not just with the patients who come in positive, but with the staff. So how important is technology in bringing some comfort and some company to these patients who, can't get visitors, can't, hear from, not just their family members, sometimes even their kids?
Yeah, it's definitely a struggle to learn technology. Not everybody uses Zoom, but we work hard to walk them through it, and it's very comforting, I think, just to see somebody, just to talk to one person, even if it's the nurse at the nurse's station, just saying hi every day. I think it would bring them significant comfort, and it's just very, there's nobody else there in the room, so so it's nice to just give them that service.
When my grandfather was in the hospital at GMH, one of the parts of the day that he really looked forward to was those times when the nurses go and check on the patients. So I can really relate to how happy these patients must be to, even if they're Zooming a nurse, right, from down the hall. Can you describe that feeling, that maybe that satisfaction you get in the midst of this crazy pandemic that's, taking so many lives? What's it like to put a smile on somebody's face because of the work that you do? They can talk to their parents, they can talk to their kids, their family members, they can talk to the nurse.
It's very heartwarming to see that your work is being used for that purpose. I don't do bedside care anymore, and I'm more in the administrative roles now, but being able to do that for patients still is very heartwarming to me. Actually, my grandmother is in the PI. She's intubated. She has COVID-19, and on the receiving end, on the other end, it's very comforting to know that you can still do that and see them, because completely you can't visit anybody there. My family there can't even visit her. So being able to have that is very important.
That's such an interesting personal insight to know that, you're a frontliner doing important work behind the scenes, and you're right there with these patients that you're trying to help. And that, our thoughts and prayers are with you and your grandma, first of all. And when we talk about, when we talked before this interview, you being a key player behind the scenes, right? That means that you've got, team members who are out there with the patients. Let's talk about that cohesiveness of that GMH family of the nurses working together with you.
Yep. So nurses and physicians, I've never seen, not never seen, but it's so heartwarming to see everybody work together to be able to provide service every day for our patients here, especially the COVID patients, because we're all worried, and we're all scared, but we try not to show show that to everybody, because we had to put up that strong front. And teamwork has been amazing here, not only on the clinical lines, the administrative lines. I mean, the leadership is, I've never seen us work so hard together as a group every day. So I'm very, very proud to be part of this team here at GMH and being able to take care of these patients every day. Yep.
I want to thank you for taking a little break to talk with us. I know you're working hard, so we're going to let you get back to working. Just really thank you for sharing your story with us. You got me there with Grandma. Our thoughts and prayers are with her and with you and with everybody at the hospital, from the patients to the doctors to the nurses and our network of nurses. So thank you very much.
Thank you so much, Chris. And thank you, KLM and Suzanne Lobaton. Thank you.
Hey, stay home and wash your hands.
Yes.
We'll see you then.